Studies here, Davis. Thank you so much for joining us today to hear about from our experts, our faculty members and scholars at 4 universities around the world, where they're conducting research around hunger, food insecurity in our communities, locally and globally. The United Nations estimates that there are around 6,090 million people who are hungry, and 1 in every 9 people goes to bed hungry each night, with millions at risk in impoverished nations of enduring widespread famine and starvation. To help address the situation, member countries of the United Nations unanimously adopted the UN Sustainable Development Goals in 2015. And goal number 2 is to achieve zero hunger by 2030. UC Davis, we are located in Northern California, and Earth University in Costa Rica are honored to be co-chairing an international effort among universities to address the SDG 2 as a part of University Global Coalition Decade of Action. Today, Earth University and UC Davis are actually very pleased to co-host this global conversation and be joined by Newcastle University in the United Kingdom and Stellenbosch University in South Africa. Our speaker today will help us understand the challenges, but also opportunities related to achieving Sustainable Development Goal number 2, the zero hunger. We know that it will take interdisciplinary, transdisciplinary, local and global approaches to address these complex challenges such as hunger. Our panelists bring perspective from a range of disciplines, including agronomy, nutrition, plant biotechnology, animal science, just to mention few. We are very, very glad that you could join us, and we are truly looking forward to learning more during our conversations. Now I would like to introduce our moderator, Dr. Ermias Kerbab. Dr. Kerbab is a professor of animal science and serves as the Associate Dean of Global Engagement and the Director of the World Food Center in the College of Agriculture and Environmental Sciences here at UC Davis. He held the CESNON Endowed Chair in the Department of Animal Science. Dr. Kerbab has been conducting pioneering research with dairy cows to find out if seaweed will reduce methane emissions from cattle. So please join me in welcoming Ermias Kerbab. Ermias, the floor is yours.
Thank you very much, Joanna. As you can see, I'm giving props to the cows that we do a lot of research with. So after decades of progress in reducing the number of people affected by hunger and malnutrition, the prevalence of global hunger began to increase again in 2015. The emergence of COVID-19 pandemic has worsened the situation again, and if recent trends continue, the UN estimates that the number of people affected by hunger will surpass 840 million by 2030. This is a pressing issue globally and locally, and universities have an important role to play in finding innovative ways to achieve the global goal of zero hunger. I'm pleased to introduce our panel today, who will describe the challenges, current efforts, and the potential ways forward. Jose Eduardo Villalobos Leandro works as a professor at Earth University in the fields of soil management and precision agriculture. The focus of his work is in the integration of layers of information, soil, plant, and remote for a successful farm diagnosis, optimizing the productive efficiency of farms through sustainable soil management and precision agriculture. Dr. Christine Stewart is Corinne L. Rustici Endowed Chair in Applied Human Nutrition and Director of the Institute for Global Nutrition at UC Davis. Dr. Stewart's research focuses on the design and evaluation of nutrition and health interventions for women and young children in low-income communities, and has had recent projects in several countries, including Kenya, Malawi, Madagascar, Bangladesh, and Ecuador. Dr. Georg Lietz is a professor of international nutrition and human nutrition research center at Newcastle University in the United Kingdom. His expertise in human nutrition focuses on fat-soluble vitamins, fatty acids, and related micronutrients. His research group is recognized internationally for its work on diet-gene interactions as an important factor in determining high inter-individual variations in vitamin concentrations. Dr. Bianke Loedolff is a research fellow at the Institute for Plant Biotechnology in the Department of Genetics at Stellenbosch University in South Africa. Her work currently focuses on using environmental manipulation to improve accumulation of bioactive compounds in salad microgreens and using functional metagenomics to identify and apply novel prebiotic enzymes. For further information on our speakers today, I encourage you to check out our website that contains links to their biographies. And following our panel discussion, with the time we have left, we will have a Q&A session during which our panelists will respond to questions from the audience. And I encourage our audience to submit their questions using the Q&A feature below at any point during today's event. So now on to our first question, which is for all of you, the panelists, and you will have about 2 minutes each to respond. So let's start with you, Jose. Could you briefly describe what you see as the biggest challenge for achieving SDG 2 or zero hunger by 2030, please?
Sure. Thank you, Dr. Inians. Very pleased to be today with you all here and sharing a little bit of our experience. Well, it's quite a question, right? There is many reasons, but I think the most important reason or that barrier that is not letting us move forward with more strength is the misconception of what hunger is. And I've seen this every time in the field. Fixing hunger is not just about handing food. And in many cases, the thing is that we are all here, I'm sure, very lucky, and we don't suffer hunger, basically, I mean, in general terms. So our understanding of hunger as professors, as people working, is not as deep as these people that are suffering. And many times the population in general that are not suffering hunger think that fixing hunger is just giving and handing food to people. But we have to think further and ask ourselves why people is hungry. And then is when the things get a little bit more complex. And this is a personal opinion. Hunger is a problem of inequality. And there is a huge link between poor people and hunger. So given the system that we live in where money is a thing, I think having these linkages between being poor and hungry give us clues or where the challenges are. So basically, that's what I have to say right now, because it's such a huge topic, right?
Thank you, Jose. The same question for George, please. George, you're muted.
Sorry. Yes. Thanks for the question. It's as Jose just indicated, it's a very, very complicated issue. But to make things even more complicated, hunger is not just simply the hunger that we see, the macronutrient deficiency that we actually see, but it's also the micronutrients that have been been discovered in the 1980s as being really important drivers of mortality and morbidity around the world. And yet, even though we've had the very successful Millennium Goals by the different international organizations, we haven't really yet tackled that problem for various reasons. And it's something that really needs to be tackled very effectively. There's been a recent drive to trying to tackle this more effectively from various angles, not just kind of trying to supplement people or trying to use fortification, but also biofortification and so on. So there are kind of various different ways of trying to address this issue. And the biggest problem that we have in the moment is that we are lacking data worldwide. Many countries that actually are affected by these problems don't necessarily collect the correct data. Data is not necessarily shared. And also the actions of various different players is not necessarily coordinated. So these are kind of like really important things that need to be tackled more effectively going forward so that hunger can be addressed from various angles and also from coordinated between various players.
Thank you, George. How about you, Bianke?
Hi, thank you very much for the question. I probably will echo like everyone else. This is a extremely complex situation to bring down to one big challenge, but I think we all will bring different perspectives here. So globally, we have become very reliant on very few heavily domesticated food crops and food resources, which are high in calories and could potentially be good to combat hunger, but very low in nutritional value. Now, although research and breeding programs are extremely effective at introducing new traits to ensure yield and survival, these traits are often based on problems encountered historically. Our ability to develop environmental resilient crops or food resources is always after the occurrence of such tragic events. And the breeding initiatives often do not account for the potential loss or lack of nutritional value. Without further emphasizing nutrition, I believe our biggest challenge is the inability of our domesticated mega crops or other food resources to pivot and adapt to sudden climate and environmental changes, which is quite a paradox, because the increased demand for domesticated food resources is what directly and indirectly contribute to climate change in the first place. So basically that comes down to domestication of the crops and their inability to adapt fast.
Right. Thank you, Bianke. Christine?
Thank you. Thank you for the question, and thank you for inviting me to participate in this panel. This is fantastic. And I completely agree with the other panelists and their perspectives. But I'll add, I think, two additional challenges. I know you've asked for the biggest, but I'll add two. First, I think, is political will. Child malnutrition is an underlying cause of an estimated 45% of all child deaths. And malnutrition in all its forms is the #1 contributor to the global burden of disease in every region of the world. Yet even knowing that, less than 1% of development dollars are spent on nutrition programs each year. So nutrition must be prioritized. It's really foundational. And we're here to talk about SDG 2, but it's foundational not just to achieve this objective, but for many of the other goals as well. When women and children are well nourished, they're more likely to survive and lead healthy lives, which is SDG 3, to perform better in school, SDG 4, have greater economic opportunities in later life, which is covered under SDG 1 and SDG 8. So I think we need advocacy and the political will to invest in something that we know works well and can have such transformational effects on people's lives. And then a second problem that I see is a lack of systems thinking to address the problem. The people at greatest risk of malnutrition are often the lowest income communities, or they're part of marginalized or underrepresented groups, often women and children. And these are often the people that have the least power in society. Yet too often we think of, we expect these individuals to overcome unhealthy food systems or inequitable access to health systems through their own motivation and choices. So we need to really think about and address these underlying systems that perpetuate unhealthy food environments, unhealthy communities, and societal inequities that are really underlying why individuals or why communities suffer higher rates of malnutrition than others.
Thank you, Christine. Let's go to a second question now. This one is for you, Jose. much of the world's population still depends on subsistence agriculture. Can you describe the potential benefits from wider adoption of precision agriculture techniques? What are some of the barriers to wider implementation, and are there particular considerations for adoption of precision agriculture in the tropics?
Thank you, Dr. Irians. The first thing is to define agriculture, because every time I go and do speeches, people have a lot of different ideas of what agriculture is, and it depends on where they were born and raised. Sometimes students from Iowa come here and they think about these big tractors with screens everywhere. And yeah, that's part of agriculture, but I mean precision agriculture. But the basis of precision agriculture is to use the right amount in the right place at the right moment. And to do that, we use technology. But technology it can be pretty much anything. I visit farmers all around Costa Rica and Latin America. And once I met this farmer, and he was using a gallon of water with a little hole popped in the gallon of water. And he explained me that way he was earning or saving a lot of water, and he was applying the right amount of water that he needed, that the agronomist told him. And that's technology. I mean, as simple as that, but that's a huge change in the way they are farming. So when we think about precision agriculture, yeah, it can go from anywhere really high tech to very low tech technology that can help us achieve those three things: where, when, and how much. And why it's important? Well, this is just a piece of the whole puzzle. There is two major reasons of why we don't get food. One is because we don't produce enough. The other one is because we're not able to move that food to another place. So we're working in this one, how to produce more food with fewer resources. Because at the end of the day, if we follow the graphs of population and the graph of how much resources we will have in the future, both are contradictory. We're going to have a lot more people to feed with less resources. Specifically about soil, we're degrading soil, so we have to become more efficient. So using precision agriculture is definitely a way to become more efficient on the use of these resources and increasing the ability to produce. And we've done it here in Costa Rica and recently Guatemala with small farmers such as 1,000 meter farmer, which is pretty small scale. And we've done it with 300 hectares, way bigger scale. Obviously, the approaches we follow, which each one of the farmers have to be completely different. And the main barrier that I find when I come and talk to the farmers about this is fear. They are scared of doing changes. And I completely understand that, because most of the small farmers have low income and low ability to bring resources into their systems. So if they have only $1, they think that the best way, and that's completely fair, the best way to invest that dollar, it's the same way they've done it before. So changing that fear into hope, is the biggest challenge that I've faced throughout the precision agriculture. And I'm not talking about bringing more technology, no, that's part of it. But the main barrier is changing this mindset of fear into hope using precision agriculture. So, yeah.
Great. Thank you, Jose. Our next question is for you, Christine. Unfortunately, malnutrition remains a concern in much of the world, and millions of children suffer from stunting and wasting. What would be some of the most effective interventions that could help the world end all forms of malnutrition by 2030?
Well, that's a big question, but you're exactly right. And for those who may be unfamiliar with these terms, stunting is an indicator that reflects when children are too short relative to what we would expect for their age, and wasting is an indicator reflecting when children are too thin relative to what we would expect for their height. And these are two forms of malnutrition. But in addition to that, if we're thinking about malnutrition in all its forms, we are also concerned about babies that are born too small or micronutrient deficiencies. And so to think holistically is an important issue to consider. Now, the good news is that stunting rates have been declining over the past 30 years, from 39% in 1990 to 21% in 2019. But the rate of decline is not fast enough to meet the SDG targets. Similarly, with wasting, an estimated 47 million children are wasted and 14 million severely so. And as you mentioned in your opening remarks, the COVID-19 pandemic is expected to make this situation much worse. So I think to talk about what can be done, first, I think there needs to be a focus on direct nutrition actions that can improve child growth, prevent wasting, improve adolescent nutrition, especially adolescent girls, and improve nutrition during pregnancy and lactation. So fundamentally, we need to improve the quality of diets that children receive as they transition from breastfeeding onto solid foods, the complementary foods that children first receive. And so the focus should be on improving dietary diversity and dietary quality through nutrient-rich foods such as meat, fish, eggs, dairy, and vitamin A-rich fruits and vegetables. And this can really set the stage for healthy dietary patterns throughout life. But for many low-income households, these nutritious foods are often just too expensive. And many of these foods are highly perishable, which is a problem in communities without good infrastructure and reliable access to electricity. So there has to be really a multi-pronged strategy. In the near term, provision of food supplements, such as micronutrient fortified lipid-based nutrient supplements, something that we've been studying, which has been found to reduce stunting by 12% and wasting by 14%, iron deficiency anemia by 64%, and child mortality by 27%. But then beyond this, fundamental programs like protecting, promoting, and supporting breastfeeding, multiple micronutrient supplements for those at risk of deficiency, and considering food fortification to improve either fortification or biofortification to improve overall population nutrient intake. But in the long term, though, we have to focus on the underlying factors that contribute to good nutrition: healthy food systems, investing in agriculture production of nutritious foods, and then beyond food, women's empowerment and education, strengthening health systems, clean environments through improved water, sanitation, and hygiene, and economic opportunities so that families can move up and out of poverty. It's a big task. A lot of things are in there, but I think to sustainably reduce and eliminate malnutrition in all its forms, we have to be thinking multidisciplinarily.
Thank you, Christine. George, the next question is for you. Micronutrient deficiencies are an important global health issue, with children in some less developed nations particularly at risk. What are some of the lifelong consequences of micronutrient deficiency, and what are some effective interventions in the near term?
Sorry, I was muted. Thanks for the question, Ermias. I think that the most important thing to remember is that micronutrient deficiencies are also called the hidden hunger. And it's for a very simple reason, is that like we see macronutrient deficiency, like Christine just nicely explained, stunting and wasting, that can actually be measured very easily by anthropometric measurements, whereby micronutrients are just suddenly, or the deficiency are invisible, yet they are absolutely critical for physical and mental development, and are particularly important in the early parts of life. And it's not for nothing that recent organizations have focused on the first 1,000 days as really important parts of human development, and micronutrients play an absolute vital part in that. And when we talk about micronutrients, we talk about minerals and vitamins that are needed for vital functions in the human body. And the other important thing to remember is that there are vulnerable groups that are more affected by micronutrient deficiencies than others, and it's particularly children, and it's particularly also women in their childbearing age that are much more affected by micronutrient deficiencies than others. The other important thing also is that micronutrient deficiencies also contribute to disability life years, or I sometimes call them also DALYs, or disability adjusted life years. And it's because that we are now able to actually combine the biological effects of micronutrient deficiencies with the economical impact that this had, that we've actually managed to amalgamate more impetus onto this area, of this really important area of trying to eliminate deficiencies, and making clear that if you invest into micronutrient deficiency eradication, you don't just simply get rid of a particular problem for a particular subgroup of the population, but you increase the economical potential of that population group as well. And in fact, invested money is not just invested to eradicate a problem, but also invest into the future of your population. So I think this really has amalgamated a much bigger drive to look at this problem more holistically. And as like the other speakers have very nicely indicated, this is a holistic problem. This is kind of like an interdisciplinary problem that needs to be addressed by a variety of different indicators. The biggest problem, however, that we still have today, and it's unbelievable to think about this, is lack of data. To just give you an example, for vitamin A, we have around the world many countries, hundreds of countries that give vitamin A supplements for their populations that have been declared as being deficient in that particular nutrient. Yet, out of all those countries, 70% of those don't really have data on which these decisions are made. And that means actually that on a year-by-year basis, vitamin supplements are given out, costing millions of dollars for these governments to support these programs, yet based on virtually no data. And that's actually quite alarming. It's for various reasons. One of the reasons is that surveys are regarded as being expensive, and it potentially is more cheaper to actually just simply give out these nutrients and have these various programs. But it's something that really needs to be changing for us to enable us to have a much better targeted approach to find out what works best. There was, for example, from UC Davis, in fact, a study that was done in West Africa that actually looked at combining different approaches, i.e. looking at, should I always just use supplements, or should I use fortification, or should I use different food-based approaches? And by combining different approaches, they actually show that not only do you target people much better in their localities, but you on top of that save money. And you generate the data that's needed to be able to drive programs much more effectively into the future. So these are kind of things that need to be considered very carefully going forward, that we need to have a better understanding as to what are the underlying problems and what are the potential solutions. And I absolutely agree with what Christine said earlier on, that one of the key components is that we need to look at it holistically and interdisciplinarity to be able to drive these different key issues. Now, one last point is that what we don't yet understand is how COVID-19 has impacted this whole system. And recent papers that came out really clearly indicated that the pandemic would have had and will have had a massive impact on the food supply system. I mean, we've seen that fresh foods, vegetables and fruits and so on were immediately impacted. The consumption was massively reduced due to the fact that we and around the world every community was relying more and more on shelf-safe foods, and that has massive implications for micronutrient supply. But not only that, we've also seen a massive reduction in the ability of agencies to get supplements out or fortified foods out to the needed communities. So all of that, we just in the moment cannot imagine what the impact of the pandemic is. And that should alarm us, but at the same time also give us impetus to really make sure that we address the issue effectively into the future, looking out, getting more data and more energy and more commitment to trying to eliminate micronutrient deficiencies going forward. So that in the end, we manage to get to the target of 2030 to trying to eliminate hunger in the world.
Thank you very much, George. On to our next question. This is for Bianke. I already seen some chats on this topic, so we'll have some more discussion after Bianke has a chance to answer this question. So one of the targets for SDG 2 calls on the international community to maintain the genetic diversity of seeds, cultivated plants, and farmed and domesticated animals and their related wild species. Could you speak to the role of genetic diversity in sustainable agriculture and how genetic diversity can contribute towards food security and reducing hunger?
Thank you for that question. Yes, diversity is the essence of biological systems. So it's no surprise that one of the targets of SDG 2 also calls upon diversity, particularly in relation to our food resources and food systems. Now, agriculture is largely dependent on kind of a supply and demand of food, and also in turn is responsible for large changes in our food systems or supply chains. And this does not necessarily always accommodate for nutritional need and supply. Now, we rely on genetic diversity, which refers to the total number of genetic characteristics in the genome of a species. We rely on this to provide us with sustainable agricultural food systems, to provide us with nutritious food and resilient food crops. So like I mentioned earlier, we have become very dependent on domesticated food resources to supply us with enough food. Such foods are considered to have gone through somewhat of a genetic bottleneck. Now, if we consider historically, 75% of all of our crop genetic diversity has been lost since the previous century, primarily due to changes in the agricultural food system, which values uniformity. And of the remaining 25%, 1/3 is expected to become extinct by 2050. Perhaps not the outlook that we want to embrace at this stage. So if we consider that the global index of hunger is based on 4 dimensions, and all of them basically encompassing malnutrition, the SDG calling on maintaining genetic diversity is for a very good reason, because it's this genetic diversity that provides sufficient systems to a plant to provide nutritional value to our food systems. Sustainability then would further speak to the ability of food crops, resources to adapt rapidly to climate or environmental changes. And this adaptability relies on genetic diversity. So plants become more and more, or animals or our food resource become genetically diverse as they undergo climate changes. They mutate and become stronger or produce better metabolites to combat their own environment. But often with the mega crops that we have, or the domesticated food resources, we have bred out a lot of those very important genes that are able to assist a plant in this rapid adaptation. So I would say that when we look at genetic diversity as a whole, we have to consider plants that have already been adapted. And when we look at already adapted plants, this is based on country to country, looking toward native species, also known as traditional ancestral lines, wild species, or orphan crops. I would consider that we incorporate such alternate strategies in our farming systems to open up the genetic diversity, which then enables our food systems to also open up to different nutritional resources for food. So we have to consider looking toward ancestral species to ensure and maintain genetic diversity of food resources, and perhaps borrow from them when we think about designing future fit crops. And of course, as a biotechnologist, I would not ignore the concept or the unique opportunities that is offered with current genome editing technologies. However, I see something like that as more of a long-term strategy, simply because legislation does not necessarily accommodate for such technologies to be readily implemented as part of a food system. Very rigorous testing needs to be done, and applications via FDA needs to be approved, and so forth. So yeah, I would close my statement to say that climate and human land use change will impact the genetic diversity of our food resources. And we need to start looking toward alternate food resources, potentially using them as intercropping systems to be used alongside mega crops, or something that is alternate to be used alongside our domesticated food resources to increase genetic diversity in this instance.
Thank you, Bianke. So we have one more last question, and then we'll open up to the Q&A. So this is for all of your panelists, and we'll start with you again, Jose. When considering the goal of eliminating world hunger by 2030, what are the most workable solutions available to us?
Sure, thanks for the question. It's not easy. One thing that I've been thinking, it's that we have to fix problems in the place where it's happening. And often we try to help and try to just to give the thing to the people that are starving, but we need to change what is happening in that place. And one way to do it, it's bringing people or one person that catalyze changes. And let's say a leader that goes a study to Newcastle or Stellenbosch or even Earth from, I don't know, Malawi. And then he comes back to this town where there are just waiting for him or her in order to increase, not increase, but to do better the way they grow their crops. Because obviously this is not the only solution, but this is one way we can make a huge change. I've seen communities where they can easily double the amount of food they are growing, and they don't do so because of fear and lack of knowledge. And myself as a professor here at Arturo University, if I go there and tell them they do that, they're like, you're not from here, how you know? But if we help bring in that one leader that is from that community to catalyze that new way of thinking and start growing from there. So we're bringing solutions from the base rather than giving them solutions from the top. So that's one way I think that is workable. And obviously there is a lot of factors involved, but for sure I've seen success cases where one person have changed the whole town or community environment in terms of food production, and also in terms of self-awareness of what they need to know.
Thank you, Jose. Same question, George. If you take 1 or 2 minutes, that'll be great.
Thanks, Jeremias. I think to be able to get to that goal in 2030, which is just 9 years from now, it's really challenging. But what we need to do is we need to think short-term, medium and term and long-term targets that need to be realistic. And more importantly, now going into the future, they need to be sustainable. Now, if you think about, and I go back to the example of micronutrients, we started micronutrient deficiency eradication by just simply using supplements. It's a short-term solution, but yet that short-term solution is still part of our daily lives today which is kind of now what, nearly 30, 40 years since we've introduced these programs. So clearly what we need to do is we have already started looking at other opportunities that are sustainable in the long term. But at the same time, we shouldn't just kind of point the finger to saying, well, we shouldn't use supplementation, because sometimes they are the most effective way of dealing with a particular problem in a particular environment or population group. So we need to be looking at the whole range of kind of the different arsenals of opportunities that we have, and including kind of, you know, agriculture and production of kind of different foods, and also looking at what Bianke just said earlier on, looking at alternative food sources that we haven't kind of or that we shied away from in the past, and exploring those opportunities much more effectively. But time is running out. I mean, 9 years is not a lot of time thinking about eradicating a problem that has been around since the dawn of mankind. And it's a really difficult issue to trying to solve that. But the good news is that there is a true international will to do that. My biggest worry is that whatever we now put in place needs to be sustainable going forward, because that is something that will plague us for decades to come if we put something in place that is not sustainable.
Thank you, George. Bianke?
Yeah, I would keep it short and sweet, because it's short-term goals, like George mentioned now. I don't necessarily think people always realize it's 9 years left. It is right on our doorstep. If we consider the use of alternate crops that are already, or food resources, this includes animals as well, that are already adapted to climate and environmental stresses where it finds itself, could give hunger and nutrition quite the boost if we have a short-term goal. We could also think about implementing different farming strategies, but things like this take a long time. And I believe Jose also mentioned early on in the webinar that change is not the biggest thing that people want to go for. You know what you're farming, and you'd like to keep it that way. And introducing something completely new into a system it takes convincing, it takes a change of a mindset. Short-term goal-wise, I would suggest, one, using native crops, making use of our orphan crop systems, the crops that have largely been ignored and is highly nutritious, and also looking toward different, perhaps growing stages of plants. For example, if I bring in microgreens at this point, they are highly nutritious, quick to grow. Within 2 weeks, you have a highly nutritious handful of food resource to eat. But this is something that will be implemented within strategies and education programs further down the line.
Thank you, Bianke. Christine?
Yeah, thanks. So I think in the near term, we should focus on interventions or programs that we have a strong evidence base and that we know work well. But they just aren't being delivered effectively. Like, we can take the example of iron folic acid supplements for pregnant women. We've known for decades, 30, 40 years or more, that iron folic acid supplements during pregnancy can reduce the risk of maternal anemia and improve birth weight in infants. Yet for many pregnant women, they just don't have access to the supplements. And sometimes that simply comes down to the fact that the supplements just are not there when they come in for antenatal care appointments. And so that's a logistics and supply chain and health systems issue. So focusing on these fundamental bottlenecks to delivering interventions that we know are effective is one strategy. And supporting our frontline community health workers and primary care providers to enable them to support women and families. But I also agree with the other speakers. I think in the long term, we need research into how to produce a more nutritious food basket, sustainably, available, equitably, and for a growing population. And as has been said already, I think, one of the gaps that we need to fill is that we don't have good data on population dietary intake. So how do we make decisions about which food to invest in, or which strategy, whether it's fortification or whether it's supplementation? If we don't have good data on dietary patterns or practices, we're really limited in the degree to which we can make strategic decisions about how to use scarce funding and limited resources. But even with our limited data, I mean, we can see from the FAO food balance sheet information that many countries simply do not produce enough fruits and vegetables and animal source foods, these nutrient-rich foods. And these are foods that are highly perishable and suffer from high losses and waste, especially in low and middle income countries. So I think also focusing on post-harvest handling and attention to the food system supply chains that provide these foods may help. So I think research funding in agriculture as well as food systems to enable us to feed our growing population with not just enough food to eat, but with a healthy variety of foods and more nutritious foods to enable people to lead healthier and more productive lives.
Thank you, Christine, and thank you, everybody. With the time remaining, we'll now turn to questions from the audience. We've seen already there's quite a number of questions that are being posed by the audience. I don't think we'll go through all of them, but at least, the panelists, so you can contact them as well. So let's start with the first one, which is what are the impacts of COVID-19 on agricultural production, or I would say more on food security? So any of the panelists would like to take this one on?
I think if no one, if I'll jump in and take a lead, I think the COVID pandemic has flayed open a lot of disparities, even within communities where we already know there are socio-economic disparities. This has further opened up this gap of nutrition and food security. I mean, if we don't even look or consider food as a an outlook, job losses have also affected people greatly. And this has its own domino effect on food, nutrition, hunger, and further increases our negative statistics when we look at combating hunger within communities itself. It also prevented people, the pandemic prevented people from their accessibility to choices of food. And from my perspective, those are some of the key components that the COVID pandemic has hit us with.
Thank you, Bianke. The next question is probably addressed to Jose. Precision agriculture techniques are quite expensive for adoption by small to medium-sized farms. How do we ensure its greater use?
Great, thanks. Well, it depends on what adoption means, because if you're doing all the baseline and getting all the data, you might use equipment which is expensive. One way that we've worked it's like, for instance, when you break your arm and you go to the hospital, you don't buy the X-ray machine. There is a center that provides this service at a low cost. So with that approach set, in smaller communities, that's what we can do. Centers that provide these kind of services at a way lower price that compared to buying the equipment. I wouldn't ever suggest a very small farmer to buy equipment in order to get their data from the field. That there is better ways to do it. So that's one way to make this accessible. And in the other hand, the expenses of implementing the recommendations that are given throughout the data that you're collecting with precision agriculture equipment. As I said before, it can be anywhere from really high tech to low tech. In general terms, if you use data in order to take your decision, you're gonna be using your resources more wisely. So that said, probably you're gonna actually earn money, and that's what we've seen, either earning money or gaining more money. Because I mean, if you have $10, we're not gonna ask you to go to the bank and make a loan, but use better those $10. And that's part of what agriculture, precision agriculture, tries to give to the farmers, the data to aid them take better decisions in the field.
Great, thank you. The next question is talking about trade-offs. Earlier, Christine was mentioning that a lot of the sort of the nutritional interventions, they affect more than one SDGs, and also SDG 2, and she was mentioning SDG 8 and others. So there is some complementarity going on there. But are there any trade-offs, sort of negative impacts of one SDG to another? Any of the panelists want to address if there's any negative impacts and trade-offs between different SDGs?
Well, I think that with many, sorry, I'm just going to jump in if that's all right.
Yeah.
I think with many kind of policy level discussions, there's often trade-offs that you have to consider with respect to who benefits and who may be left behind from different strategies, or potentially who may be harmed. So, for instance, if we just focus on narrowly on something like increased productivity without thinking about equity issues, and how often, women may be left out of decision making or out of opportunities, then we could have unintended harms on populations or communities. And so there's often those considerations that need to be weighed with respect to the degree to which you might prioritize and focus narrowly on just one issue or one target, but then you might be missing the bigger picture. And so that's why I like to focus on the complementarities and the ways in which if we think about nutrition, it's supporting so many other goals. And so it has the opportunity for many knock-on benefits. But it has to be, we have to think about it with an equity lens and with diverse populations in mind.
Great, thank you, Christine. I love those questions. They're coming from all over the world. So you have a question from Nigeria, from Pakistan, from Chile. So this is great. So the next question is looking into sort of nutritional guidelines and looking into considering that animal source food are good for micronutrients and as such, but then you have a lot of negative press on environmental impact of animal source foods. So how do you reconcile this? In one hand, you need the most nutrition for food available, particularly to the stunting and wasting, and on the other hand, you have this like demonization of animal source products. So how can you sort of get those in balance and at least communicate that animal source foods would be a good important part of the nutrition system, or is it?
So if it's all right, I can jump in again with answering that question, but feel free for other panelists that might want to jump in too. I think that we need to really think carefully about equity. So with respect to animal source foods, the greatest benefit is to children and to women of reproductive age, especially when we think about children. Young children have a limited number of calories that they should be eating on a daily basis. And so those calories need to be delivering not just the energy, but they need to be delivering the best package of nutrients possible. And animal source foods often provide a very micronutrient dense, or they are a micronutrient dense food. And so I think for children and for women of reproductive age, animal source foods are a beneficial part of the diet. But there are, with all of our food, we have to think about the land, water, air use and environmental implications of production. And with that, I think that research can really help. I mean, I'm especially inspired by your work, Ermias, in this area, because I think that it shows that with research, we can have improvements into how we can produce food more efficiently with potentially fewer environmental impacts. And so we can have the benefits of improved nutrition, but do it in a more sustainable way. So I don't think that it's just about reducing some of the messaging that comes forward with animal source food production. I don't think that it's just about reducing consumption in high income groups. I think it's also about being more strategic about how we produce that food sustainably.
Thank you, Christine. George, do you have something to add?
Yeah, I wanted to add kind of like to what Christine just said, is that I think we need to always look at it in the context as to where the criticism is coming from. And clearly what we need to remember is that to produce 1 calorie coming from animal source, you need to input 10 calories from plant sources. So that's kind of like where this whole debate is coming from in terms of, you know, whether it's the right food to focus on. But what Christine really nicely pointed out is that, you know, there are certain reasons as to why animal foods are really important in terms of overall human nutrition, and it needs to be a balanced diet. But the question we need to ask ourselves in terms of the future and looking at making food supply and food delivery and food production more sustainable going into the future, we need to ask ourselves what's the right balance, and base that clearly on good science in terms of production, but also in relation to nutrition. The question we need to ask ourselves is kind of like, what is the right amount of an animal-based food consumption that is sustainable going into the future, that's not sustainable just for one particular part of the population or a particular area of the world, but is sustainable for the whole world population. That's the question we need to ask ourselves into the future. Animal foods are here to stay, but we also need to think innovatively. I mean, there are lots of new ways of looking at animal protein production, including things like insect protein, for example, that can be used either directly to human nutrition or even indirectly by using animal protein to feed animals. So, you know, there are different ways of kind of trying to become more innovative and use research to kind of drive that process. But also what is really important is education. We need to educate more people around the world that the issue of sustainability and equity is something that really needs to be a forefront in our decision-making process.
Thank you, George. I really enjoyed this discussion, and I hope this is just a beginning of this global conversation, and we'll continue to do this as well. So I just like to thank our audience for joining us today and for submitting their questions. And thank you to our panelists for taking the time to be with us and for the lively and informative discussion. So, but before we go, I'd like to hand things over to Yanin Chan, who is the Dean at Earth University in Costa Rica, to give us some closing thoughts. Yanin?
Hello, everyone. Well, first of all, what I want to say is thanks to all of the panelists for a great conversation. Thanks to everyone who was connected in this event for participation and your engagement. Thanks to everyone who participated in putting together this excellent event. It's not easy to coordinate across the world, across the time zone, and across university schedule. As a dean of our university, it is a pleasure to see concrete action as part of our partnership with UC Davis, Newcastle University, and Stellenbosch University to join us. and promoting the work of universities around the globe in supporting the SDG 2. That is why it's a great satisfaction to see the geographic representation we have had today from different continents. And it is also great to see not only our faculty represented in this meeting, but also our students. That is one distinctive element of the UGC initiative. And of course, we know that much more is needed. When I was listening to the panelists talking about our agricultural system, how we need to change maybe the way how we are feeding us. When I was listening about macro and micronutrients, genetic diversity, nutrition, supply chain, inequality, access, data, this crisis that is taking all the world. And finally, understand that everybody here talking about education and how we have to change that. It's clear that it's not only one way to do it. There are many, many ways, and it's in our different position that we can do something. And this is just the beginning. We need to bring together more and more universities in this crucial work for our common futures. I would like to invite all of you to the second annual conference that will be running in September. And thanks again to everyone that get involved in this amazing webinar. And congratulations to all the panelists for that great presentation. Have a great day. Thank you very much.
Thank you all.
Thank you much, everybody. So see you. Thank you.
Thank you. Bye-bye.
Thank you. Bye-bye.